Hello, all you Red Wolf fans. My name is Frances Butler. I'm a senior family nurse practitioner student with the College of Nursing and Health Professions here at ASU. My project title is Our Rural Primary Care Clinics Adhering to the National Guideline of Non-Pharmacological Treatments as First-Line Care of Low Back Pain. My mentor for this project was Dr. Christopher Jordan. I'd like to start out my presentation by giving you all some facts about back pain. It's the primary contributor for missed work days and the leading cause of disability in Arkansas, as well as worldwide. It is the most frequent reason for healthcare visits and the most common reason for opioid pain treatment. Now, this trend to treat pain with opioids began back in the late 1990s when pharmaceutical companies encouraged providers and clinicians to prescribe opioids for pain, claiming that they were not addictive. However, we now know that they are extremely addictive. As a matter of fact, in 2017, 1.7 million Americans claimed to have an addiction to opioid painkillers, and these are prescribed painkillers. And unfortunately, also in 2017, 47,000 Americans died of opioid overdoses. 188 of those were Arkansans. So to fight this epidemic, the American College of Physicians released a new clinical practice guideline. This guideline called for first-line treatment, which means the first time they come into the office with low back pain, they should be treated with non-pharmacological methods instead of opioids. So the purpose of my study is to compare an Arkansas clinic's first-line treatment of low back pain with the first-line treatment in the Northwest U.S., consisting of physical therapy at 8.7% and opioid prescriptions at 25.3%. This is a slide showing the comparison study with physical therapy being prescribed at 8.7% and opioids at 25.3%. The objective of my study was to determine whether first-line treatment practices of low back pain with opioids at an Arkansas rural clinic, if they were better than those of the Northwest U.S. Now, what I wanted to do with this information was increase the provider's knowledge of how they practice, of their practice patterns in the clinic, so that if they needed to, they could set future goals for improvement. That way, it could help with the opioid crisis in America. Prior to data collection, I did receive permission from ASU's IRB and from the site where the data was collected. The method I used for my project was a retrospective chart review of 50 electronic medical records that was conducted at a rural Arkansas clinic. Now, the charts that were reviewed included both male and female patients between the ages of 18 and 64 with an ICD-10 code of M54.5. These patients visited the clinic between November the 1st of 2018 through November 18th of 2019. I did exclude some patients from this study, and those were patients under the age of 18 and over the age of 64, and those without an ICD-10 code of M54.5. To obtain my findings, I used simple mathematical calculations. I used those calculations to determine the percentage of patients receiving physical therapy versus opioids as first-line treatment of low back pain. Out of the 50 charts that were pulled for my study, only 32 of the patients met the criteria for the project. 0% of those patients received physical therapy, and only one patient, which came to 3.1%, was prescribed an opioid. All other patients, which was 96.9% of patients, received other medications, including muscle relaxers, steroids, or NSAIDs. The rural Arkansas clinic did not meet the new guidelines set forth by the American College of Physicians to treat low back pain. However, the clinic's opioid prescription rate was found to be lower at 3.1% than those prescribing rates in the northwestern United States, coming in at 25.3%. Ultimately, non-pharmacological treatment has been proven to be better treatment for low back pain. The clinic was at 0%, leaving room for 100% improvement. Although the guideline is not being met, they are performing significantly better than the northwest part of the U.S. in opioid prescribing habits, which reduces their patient chances of opioid overdose.